Imagine a disease that affects 1 in every 20 women in the United States. It's called Pelvic Inflammatory Disease, or PID for short, a rather insidious infection of the female reproductive organs. Today, we dive into the depths of this condition, its causes, symptoms, and treatment. Pelvic inflammatory disease is an infection that takes hold in the lower abdominal region, which includes the fallopian tubes, ovaries, cervix, and uterus. It's usually caused by different types of bacteria, including those responsible for sexually transmitted infections, such as gonorrhea and chlamydia. Initially, the bacteria enter the vagina, causing an infection that can, over time, spread to the pelvic organs. If unchecked, this infection can prove life-threatening if it enters the bloodstream. Several factors increase the risk of developing PID. It's more likely in those who have had an STI, particularly gonorrhea or chlamydia, but it can also occur in those who have never had an STI. Other risk factors include being under the age of 25, having multiple sexual partners, not using a condom during sex, recent insertion of an intrauterine device, douching, and a history of PID. Now, you might be wondering, how do you know if you have PID? The tricky part is some women with PID don't have symptoms. For those who do, symptoms can include lower abdominal pain, upper abdominal pain, fever, painful sex or urination, irregular bleeding, increased or foul-smelling vaginal discharge, and fatigue. Diagnosis of PID involves several laboratory tests, including a pelvic exam, cervical culture, and a urine test. Additional tests may include a pelvic ultrasound, endometrial biopsy, and laparoscopy. So how can you get PID? The risk increases if you have an untreated STD, multiple sex partners, or a partner who isn't monogamous, have had PID before, are sexually active and under 25, douche, or use an intrauterine device for birth control. The best way to reduce your risk of getting PID is to avoid contracting STDs by not having unprotected sex. If you are sexually active, you can lower your chances of getting PID by being in a long-term mutually monogamous relationship with a partner who has tested negative for STDs, and by using latex condoms every time you have sex. In summary, pelvic inflammatory disease is a serious infection of the female reproductive organs caused primarily by bacteria, with several risk factors contributing to its occurrence. The symptoms vary, and it can be diagnosed through a series of tests. Prevention is the best strategy, and it involves safe sexual practices and regular health checkups. Remember, early detection and treatment is key, so don't hesitate to seek medical attention if you have any concerns.